flexion extension, right? Typically flexion extension we expect in the sagittal plane, but for the fem, flexion extension lives in the frontal plane. So when we're aligning the goniometer, you're going to find, correct me if I'm wrong, somebody pull up that document. I'm pretty sure it's scaphoid for your bony landmark for the fulcrum.
Oh, it's farther down.
I'm pretty sure it's scaphoid.
Flexion?
Yeah, for flexion and extension.
For flexion, dorsal midline metacarpal for proximal arm. Fulcrum is dorsal aspect MCP joint, and distal arm is dorsal midline proximal phalanx. Right?
Where's
Is
Is that?
thumb MCP flexion? Is that right?
CMC.
Sorry.
I was like,
Trapezium and first metacarpal.
okay, so
Palmar first.
trapezium,
Yeah.
first metacarpal, and then is it along the?
Fulcrum is Palmar first CMC joint, and then
Don't listen to anything I say.
the proximal arm is ventral surface of the radial head, radial head styloid,
Got
and
it.
then the distal is ventral midline, first metacarpal.
Got it. Okay. All right. So if we're assessing first for mobility, you're going to stabilize at the trapezium, right? So, so if you remember how to find the trapezium, you can drop off of that lateral aspect of the radial styloid process. You can do radial and ulnar deviation, and that bone will pop into your hand. And then you just grasp it, almost like a pincer grasp, thumb and index finger. And then you're going to move that metacarpal into flexion and extension. Okay. Does that feel okay? Mm-hmm. Okay, good. All right. So then, if we go to flexion first, I'd estimate maybe she has about 10 degrees or so of flexion. And then I'd keep her there. You know, align our goniometer. So again, on the trapezium for your fulcrum, along the radius for the stable arm, and then along that metacarpal. And she's got about 8 degrees. 8 degrees, okay? And then if you keep your stable arm there and the fulcrum where it is, you can just bring the fem back out into extension and move your moving arm with the metacarpal. Okay. And she has about 50 degrees of extension. Okay, so that's flexion extension of the thumb. And then to measure abduction and adduction, I'd have her with her forearm supported. Can you guys see on the video at least? Because I know it's going to be not facing you. Okay. So for abduction, taking the thumb as far up as it can go. And again, I do want to stabilize on that trapezium as I move the metacarpal. Okay. And then in terms of your bony landmarks for this, you're going to use the side of the trapezium. The moving arm will go along the metacarpal, and the stable arm will be along the radius, along that radial styloid process. Okay. So then we take our stable arm, fulcrum again on that trapezium, and then move the moving arm along the metacarpal. Okay, well, that's about it. And then you take your measurement, about 50 degrees of adduction. And typically adduction is not measured because it's just adduction is back to neutral, unless there is some sort of restriction or dysfunction.